Hi, I'm Sam, the founder of The Wonderhood. I'm a hypnobirthing and antenatal teacher and a mum of 2. I believe that all births are unique, and no matter the place or type of birth you choose, if you have the knowledge and practical tools, then you can confidently approach birth in a way that is right for you, your body and your baby. In this video, I'm going to talk to you about your rights and teach you a framework to help you stay in control and take responsibility for your birth, regardless of the path it takes. So feeling in control of your body and your birth is a really good way to help you have a positive experience. So in order to take responsibility, the fundamental thing that you need to have is knowledge. This is knowledge of your body and what's actually going to happen, as well as knowledge of your options. When you have all this information, then you can make truly informed decisions, and that will allow you to feel in control of your birth. So this is one of the most important parts of this course, learning to step up and take ownership, because ultimately you're responsible for your own birth. So throughout this course, I'll give you the knowledge that you need to feel confident and make the best decisions for you and your baby. Then whatever choices you make, these will be yours and you'll be in control of your care. You can then be supported by your midwife instead of handing over all responsibility to them. And this can be so empowering for you and your mental health. And then when you look back on your birth, you're more likely to feel comfortable and happy, knowing that you made all the decisions that were best for you in that moment. And you didn't just become a patient and jump on the hospital conveyor belt and basically have things done to you without understanding what or why they were done. The cause of a negative birth isn't always because of what happened, but often it's because of the lack of control. And that can leave people feeling really confused and upset once their baby arrives. So make your own choices based on knowledge. Take ownership of your birth, and you'll be more likely to have a positive experience regardless of what happens. While we're talking about positive birth, I just want to point out that a positive birth doesn't have to be a home birth with fairy lights and a 2-hour labour. It could also be a 48-hour labour and an unplanned cesarean birth. Only you can decide how you feel about your birth. So these are a few ways that you can take ownership of your birth. One is always follow your instincts. Second thing is have a strong birth partner to advocate for you. That's so important, birth partners. Third thing is having the right birth team that respect you and respect your wishes. Fourth is remember that it's your body and it's your choice. Fifth thing is practice and prepare. Practice relaxing, practice breathing, practice exercise, practice everything and prepare. And then research and learn so that you're fully informed about what's going to happen. And being informed during birth is so important. Ultimately, the responsibility for being informed lies with you. So when anything is offered to you by a medical professional, you're required by law to give informed consent, and that is from the smallest thing, like taking your blood pressure, to something as big as a cesarean. Your consent has to be given freely and without being coerced or persuaded. But in reality, there is a little bit of a grey area, and medical professionals, yes, they always get consent, but people often aren't fully informed about the consequences or the risks. So when people are trying to get you to do something, they will often happily tell you the benefits, but not always the risks. So make sure you have all the information. So when you give your consent, it's fully informed and you know exactly what you're agreeing to. Okay, I have a framework that you can use to help you remember this. It's an acronym. The acronym is BRAIN. B-R-A-I-N. B is for benefits, R is for risks. There are benefits and risks in everything we do, so we need to know these risks and know the risks of doing nothing before we can make a fully informed decision. And risk is individual to every single parent. You need to make the best decision for you and your baby based on what you would class as a comfortable level of risk, and no one else can make that decision for you. Your midwife or care team will be able to tell you the benefits and the risks, or you can read more about it yourself in your own time. A is for alternatives. So there are always alternatives to every suggestion. Find out what they are so that you can work out what is best for you and your baby. Your hospital will often offer you what they think is the safest option, but this might also be the cheapest or the least time-consuming option, and this might not be right for you. Okay, I is for instinct. What does your instincts tell you? They are so powerful in birth, and you're the only person that can feel what is happening to your body and then tell people what you're experiencing. So really listen to your instincts, and more often than not, they will lead you in the right direction. And then finally, N is for nothing. So this is a great one if you're feeling pressured into making a quick decision. Simply ask, what happens if we do nothing? So that might be for 5 minutes, for a few days, or a few hours, but if there are no negatives to waiting, then you might prefer to have more time to make your decision, to prepare for a new pathway, or simply to allow labour to progress naturally. And sometimes taking a pause and being patient is actually all your body needs. And then finally, I want to talk about 2 very important words in birth: no and allowed. As humans, we're pretty good at doing what we're told, especially if it's by someone in a position of authority. For example, a midwife or a doctor. So it's important to remember that pregnancy is normal and it is not an illness. You choose what happens to your body every step of the way. And if something makes you feel uncomfortable at any point, you are entitled to say no. It doesn't matter who's doing it or what they are doing. Saying no can give you time to use your brain. You can ask about the benefits and risks. You can ask for more time to decide, or you can just flat out say no. Okay, so now the word allowed. People often use this word when they're talking about birth. For example, they've told me I'm not allowed to go past 40 weeks, but you are allowed to do whatever you like. Your midwife or consultant will give you their recommendation, and obviously you should always listen to their medical advice because they're the experts, but just remember that ultimately the decision is down to you whether you accept or decline what it is that they're offering. It's your body, your baby, and your choice, so don't be afraid to speak up if you're uncomfortable. Okay, so now you know your rights and how to make well-informed decisions using your brain. This will help you navigate your birth in a positive way by putting you in control and allowing you to take ownership. Thanks so much for watching this video, and I'll see you in the next one for more resources and tips for a positive and informed birth. Bye!